Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our Hospital System General Director. Today is Thursday, May 20th, giving you the update from Albany Med. All right, Fred, we'll pop open the first graph. Capital Region, 8 counties, 64.
Still heading down, Dennis.
It's going in the right direction,
Going
which
in the
is
right
great
direction.
news to see. Next graph here is admissions and discharges to the medical center. Not really much to say. A couple a day, admitted, a couple a day discharge, looks about the same.
Yep.
And then the next graph here is the morning census at the medical center. So 15 in the hospital, 11 on the floor, 4 in the ICU, and 1 on a ventilator. So those numbers are definitely down from a week ago.
They are. We're, gradually going in the right direction.
For sure. Let's talk about vaccine numbers here. Capital Region, a couple really good numbers to report. There was a lot of activity over the weekend. We talked about this. The 12 to 15 population opened up. So in the Capital Region, in just the last 7 days, there was, I think, close to 25,000 people vaccinated, which is wonderful. I think most of them were probably in that younger category. Our total so far, 619,000, Fred, have received at least a first dose. 68.2% of those 18 and above in that population have received at least a first dose, which is wonderful. And then we've talked about this because we're very proud. The Capital Region hub, 10 hubs in the state. When you look at our numbers, the region has the highest percentage of vaccinations. But interestingly, in those 8 counties of the Capital Region, they're all doing remarkable. Right now, Schenectady County has the highest vaccine percentage by county in the entire state.
Shout out Schenectady County, good job.
So they're doing great. So everybody's doing a great job, and we keep up the good work.
Dennis, the reason the numbers are going down in terms of cases and hospitalizations is because of this.
I agree with you.
Because of the vaccination rate in this community.
I agree with you. Fred, the other day we talked about the vaccine and the variants, and when I listened back to the video, I'm not sure I explained it as well as it could be. Try it again. Talk about how the vaccine efforts are working despite the fact that there's variants here.
So, Dennis, the variants are more infectious.
Right.
So in a stable circumstance with variants rising, you would expect the infection rate to go up.
Right.
That's not happening.
Right.
And one of those variants is 50% more infectious.
Right.
And that's not happening because of the vaccinations.
Right. Yeah. Okay. Well, as I thought, you did a better job explaining it. So thank you. Bottom line is the vaccine efforts are making a huge difference, and we're happy about that. All right. We're going to call this Questions for Fred, coming out of the mailbag here. The first thing is we both got an email this morning, Fred. Somebody said they're aware of some published literature that says that the immunity associated with the vaccine might last 6 months. And some people are coming up on that 6-month window of when they got the vaccine. So the question is there going to be a booster? If so, when? Can you talk a little bit about that?
So, Dennis, let's start with the science around the immunity that you get from the vaccine. So the vaccine is relatively new. There is some data. So there's a New England Journal article, which we've talked about previously. And what it looks at is the decay of the level of antibody in your bloodstream after you've been vaccinated. Now, that decays over the course of months. So there's something we call the half-life.
Yes.
So how long does it take to go from 100 to 50?
Right.
That's measured in months in that study. So at the least, the vaccine creates immunity for 6 months in people. So that's clear. When you look at some of the studies that, again, we have posted at least one of them, and there are more now, on immunity after native infection. That now has been measured even further out, 8 months out. You still have T cells that understand that that provide immunity, as well as antibodies. So 6 months for sure, probably longer.
And so does that lead you to believe whether or not it will be necessary for us to get a booster?
So if you look at the curves, the antibody levels are going down. So my guess is that there will be a booster that we'll need to get, perhaps on an annual basis. But I think, let's see. Let's see what happens.
All right, so let's link that to another question we got, which is every year when we get the flu vaccine, they model the strains that they put in there based on the activity of flu the previous year, or at least in the southern hemisphere.
That's right.
This year we know there was very little activity of flu. So any thoughts on how they're going to come up with the flu vaccine this year? And then I'll put the next question with it at the same time. Will they consider maybe doing flu and COVID in one vaccine?
So Dennis, I'm not a content expert here, but I'll give you my educated guess. they will probably use the strains from the prior year. Because think about it, the flu, like COVID, morphs when it's reproducing. If it hasn't been reproducing in the population, perhaps the strains haven't really changed. So that would be my educated guess around the flu. With regards to combining the two, that's an interesting question. I'm not sure at all. There are two different types of vaccine. One's an attenuated virus. The other is an mRNA virus, a particle. So I'm not sure. I really don't know the answer to that.
Well, they're great questions, and we love getting them.
We'll keep that in the mailbox, and if I hear anything about that, I'll bring it forward.
Yeah, there's no question. We'll revisit it again later this summer, but we'll keep the questions coming.
Absolutely.
So Fred, it's Thursday, so we always talk about length of stay and the efforts there. I mean, everybody who's watching this who works at the medical center knows things are getting busier. We crested over 700 today as far as people in the hospital. ER very busy, OR's busy. Length of stay never more important.
That's right, Dennis. So let's pop up the graph. Here's the length of stay this week. Again, the dotted line is total length of stay. The solid line subtracts out the COVID population because they have a longer length of stay. You can see the two lines are starting to come together.
Yes.
We're hovering, Dennis, in that 5.7, 5.7.5 a day. We really need to bring that down. As more patients need our services, length of stay is so critically important. It's better to get people out of the hospital to the next place for the continuation of the care. That's one piece. But as importantly, it creates capacity here at the medical center. And we've heard that some of the other major institutions around us are struggling with their capacity, and we're seeing people from a little bit further away. Transfers, that's right. So very, very important. We really need to double down on our efforts around length of stay.
All right, very good. And before we go to the last topic, were there any other articles that you wanted to talk about, or did we cover them all?
No, I think we covered them. They're on the library website already, so go there and read them, and you'll get more information about the longevity of immunity. All
right, very good. Last topic. So, Fred, it's Critical Care Awareness Month.
It is.
It's Critical Care Spirit Week. One of the things that I love, like you do, about walking around the hospital is you bump into people. So I bumped into Mindy Dame this afternoon. She, of course, is a nurse manager in the CPS, our cardiac surgery ICU. And she was showing me some pictures of the workforce up there. And it's a great example of how you can provide literally world-class care, which they do, and still have the opportunity from time to time to have some fun with it and bring some spirit into work. So I think we have a picture of them, and we congratulate them for that. And they want to remind us that tomorrow
is Wear Blue to support critical care.
Right. So we're going to do that. I'm already doing it today.
Yeah, I think I have blue on too.
And then another thing about the ICU very quickly. Today we discharged from the hospital a patient who had been here for over 100 days from the surgical ICU. And I mention that because I walked through the unit, and it is remarkable, Fred, when you think about the amount of effort it takes to provide care to someone who requires to stay in the ICU for 100 days. And every single person I spoke to had taken care of this individual for at least a couple days. And they were very proud, and obviously we wish him well. He's on to another location to get some rehab. But a credit really to the entire surgical ICU team for that incredible effort for over 100 days.
You know, Dennis, you've heard me say this before. One of the things that we do that's critically important for our community is critical care services. We are the highest level of institution for those services.
No question.
The SICU, you know, I have a personal experience with the SICU, and the effort that they put in on one of my family members, likewise, was just tremendous.
Yeah. So, critical care, the entire team. This is your month. This is your week. We congratulate you. Okay, we'll be back again on Tuesday. All right. Weather's going to be great. Those working here this weekend, we appreciate you. We thank you. Everyone else, we'll see you on Tuesday. We ask that you once again please take care of yourself, take care of each other, and we'll see you in a few days.